Hello, Wayne County Community College students. This is Dr. Crystal Morrison here to teach you, or we're going to learn about the respiratory system. This is Human Anatomy and Physiology, Part 2, also known as Bio 250. I think the last time we met, prior to this coronavirus pandemic, I think we were on the respiratory system, actually just finishing up. But I'm going to do an entire video, or entire recap of the respiratory system. So just in case these past few weeks that we haven't been together, you'll have an opportunity to review it, and then we'll go on and finish up. All right, so let's get started on the respiratory system. Make sure you have your textbooks with you when you look at this these videos, and we'll start on page 801. 801. All right, that's the respiratory system. All over the world, people are doing their classes and they're learning via remote. So we're just joining the rest of the world for the time being until we get over this pandemic, and I won't mention it anymore because we all know why we're here. All right, let's finish up on the respiratory system. Functions of the respiratory system. I'll put it up here so we'll remember, because we're going to have a series of these YouTube videos, and I want you to know where we are each time. So, respiratory system. Functions of the respiratory system are, it's an air distributor and a gas exchanger, right? So oxygen is supplied to the cells while carbon dioxide is being removed from the cells. For example, here's a cell. We'll just say it's any cell. It doesn't matter. The point is that you can see that in the respiratory system of aerobic beings, which we are, oxygen is supplied to the cell while carbon dioxide is being removed from the cell. That's a really good system, especially when we use the trees, the grass, plants that supply us with oxygen, which is their waste, by the way. Our cells utilize the oxygen, and then we, as humans or aerobic beings, give off our waste, which is carbon dioxide, which in turn is used by the plants and trees and the flowers. So it's a great system of utilizing oxygen for us, and the plants and trees utilizing the carbon dioxide for them. So it's a very symbiotic relationship. So that's one of the functions of the respiratory system. Another one is the respiratory system filters, warms, and humidifies the air that we breathe. For the most part, we should breathe in through the nose. That way, by the time the air reaches our lungs, it's been warmed and humidified. And it's not so cold, hard, crisp air that's going into the lungs. You don't want that. So breathing through the nose allows the time for the air to be humidified and filtered. Also in the respiratory system, it influences sound production, including speech. So there's specialized epithelium in the respiratory tract even to make olfaction possible. Olfaction is the sense of smell. So the respiratory system participates in the function of phonation, which is our speech, as well as olfaction, which is the sense of smell. So the respiratory system is more to it than just, oh, they're breathing. It's more to it. Sense of smell, speech, filtering, warming, humidifying, and of course, this whole gas exchange with the cell of oxygen and carbon dioxide. Those are the main functions of the respiratory system. Now, if you'll look on page 801 in your textbook, you'll notice that the respiratory system is divided into two parts, an upper respiratory and lower respiratory system. So the upper respiratory system are organs that are located outside of the thoracic cavity. In other words, they're outside of the chest. They're up here. So that would include the nose, the nasopharynx, the oropharynx, the laryngopharynx, and the larynx. So that's the nose, the nasopharynx, which is the nose throat, pharynx is throat, oropharynx, which is the mouth throat, and the laryngopharynx, which is the larynx throat, and of course the larynx. So that stops about right here where our voice box is. That's the larynx. Those are things in the upper respiratory system. On the other hand, we have a lower respiratory system as well. The lower respiratory system are mainly things that are located within the thoracic cavity. So they're in the chest. The trachea is not in the chest, it's right here in the neck, but it is a part of the lower respiratory system. So we have the larynx, the trachea, and all the segments from the bronchial tree into, and of course including the lungs. Those things will be considered the lower respiratory system. And you can see that on page 801 in your text. Accessory structures would include the oral cavity, which is the mouth, the ribs, the rib cage, the respiratory muscles, which are usually intercostal muscles that are in between the ribs, and of course this great sheath of muscle known as the diaphragm, which is very important in our respiratory system. So upper, lower, and then accessory tract. Today we're going to talk about the upper respiratory tract. So let's talk about, one of the first things we know is, let's talk about the nose. Just drawing the nose here. We'll just say that's a nose. The nose, of course, has an external and internal portion. The external portion of the nose you can see. Like you can see it on anybody's face, right? The external portion consists of a bony and cartilaginous framework overlaid by skin with many sebaceous glands. You guys remember what sebaceous glands are? Correct. Oil secreting glands. That's right. So you have oil secreting glands on our nose. We have a cartilaginous part that can move, but we also have a bony structure here. So when someone says, oh, they got their nose broken or their nose is broken, that part that's broken is this bony part, not the cartilaginous part generally, because that's pretty wiggly, as you can see. So the internal nose, let's go to the inside of the nose now. The internal nose, or the nasal cavity, lies over the roof of the mouth and is separated by palatine bones. So here is the nose. I'll just draw this philtrum. We'll put some lips here. The roof of the nose is, the internal nose or nasal cavity lies over the roof of the mouth. So the roof of the mouth, or the top of the mouth, is here. Those would be palatine bones. And you could feel like your palate, which is at the roof of your mouth with your tongue. Palatine bones make up that palate. Sometimes when there's a failure of the palatine bones to fuse or to completely unite, we call that a cleft palate. So the palate may not form totally. So as the bones come in to meet, maybe there's something that stopped them from meeting. And at the roof of the mouth, there'll be a little hole or separation there. That's a cleft palate. Sometimes it could come all the way out to the lip, and you can see part of the lip is missing. And that, of course, be a cleft lip. That can allow difficulties in swallowing and speaking. In babies, oftentimes, when that is noticed, so that they could suckle at the breast or the bottle, the nipple, whatever, they'll put some type of prosthetic in the mouth so that the roof of the mouth will be fully closed so that they can get a good suction until they're able to have surgery, which will be probably pretty soon, so that they can eat properly. But clefts, palates, cleft lips can cause difficulty in speaking and swallowing. Cribriform plate Cribriform plate, we talked about the roof of the mouth. Let's talk about the roof of the nose from the cranial cavity, which would be here. Cribriform plate, I'm just going to put some little holes here so that you'll know that this cribriform plate separates the roof of the nose from the cranial cavity. In other words, the bones that house your brain. Cribriform plate is pretty interesting because it allows aromas that come up through the nose to go up through these little holes that are in the cribriform plate and go into your brain. So you can differentiate what a smell, what the aroma is, what the smell is. You could be lying in bed, for example, and your parents could be downstairs making a meal and breakfast like blueberry muffins and coffee, scrambled eggs and turkey bacon, things that you might like, and you can lay in the bed and smell that, and that aroma will come up through the nose, go up through that cribriform plate, and your brain can differentiate what each smell is. It's like, blueberry muffins, coffee if you like coffee, turkey bacon, turkey sausage, whatever, eggs. So that's a good thing about these holes in the cribriform plate going up to your brain. Also though, these holes in the cribriform plate can provide a passageway for parasites. So it's not always a good thing. Sometimes maybe you dove into a still pond. Maybe you were camping and these little bugs and little insects are floating on top, and you dove in, and later, maybe a week or so later, you start to feel headaches or nausea, you start to feel sick, feverish, and you go in and the doctor starts asking you your history. And have you gone anywhere lately? Have you gone on done anything unusual? Oh, I went camping. Oh, really? What happened? Well, I did go swimming and blah, blah, blah. So they'll take your blood and see that you have a high, probably eosinophil count, whatever. And then they'll say, oh, you have parasites or something. So little things can work their way up through that cribriform plate and get into your brain. So it's a good thing for smell, so you can differentiate what you are smelling. Something that smells putrid, something that smells, has a nice aroma, or it can work towards other things getting up there. Not just bacteria, not just parasites, but sometimes bacteria too. The septum here in the nose, a septum is a wall, by the way. So this wall separates if I were doing this anatomically correct, this is going to be the right, and this is the left side of the nose along this septum here. That's a midline partition that separates the nasal cavity from the left and the right. Okay? So we'll talk a lot more about the septum. Sometimes if you do a little bit too much drugs like cocaine, sniffing, you can damage the septum, and then you can have to get it replaced. There's a singer that did that quite a few times, and it ended her singing career because she kept getting replaced, and that it made her sound differently when she sang. So we'll just leave that at that. What would you say is a number one cause for nosebleeds? I'm just asking. What would you think is the number one cause? Well, good. Maybe hypertension, right? That's a good, I'm glad you said that. That's a good example of why somebody has some blood pressure that just went really high. It's got to relieve the pressure some kind of way, so it's going to make the nose bleed. That's possible. Some people, that's another good thing that you said. Some people are very sensitive to heat, and if they get too warm, their nose will bleed. But the number one cause of nosebleeds is trauma, and that kind of trauma, we call it nose picking. Picking at your nose will cause your nose to bleed, and that trauma, of course. Epistaxis, or epitaxis is the number one cause of a nosebleed. So epitaxis is a nosebleed because the nose is very vascular is a rich blood supply, and the number one cause of epistaxis is trauma or nose picking. Other causes are like high blood pressure, or I forgot this one, what about missing clotting factor, such as like factor 8? That could cause a nosebleed too. Each nasal cavity is divided into 3 passageways. There's a middle, superior. There's a superior, middle, and inferior nasal conchas or turbinates. They're named by the location or projection of the turbinates or conchas. You can use those words interchangeably, I do. May not be quite exactly right, but it'll give you the general idea of what we're talking about. The nose is they're folds in the nose, and they're in the lateral walls of the internal portion of the nose. Let's see. So this is a frontal view. Let's give a side view of the nose. Let's try this way. All right. So these little layers here. This says this is the top one. This would be the superior. This is the middle. And this is the inferior. And you could call them, I interchange them, but you could call them turbinates or nasal concha. Yeah. So the turbinates or nasal concha, they provide a large mucus covered surface area that air passes through before reaching the pharynx. So I need you to understand that air is going to come up, well, mainly up over this way through the nostril, up, and it's going to go over the inferior, middle, superior, and then into the back of the throat. That's the way the air will travel. You're going to have to know how air travels before it gets into the pharynx. So that would be one thing for you to know. But before we get into all that, I want you to know that this nostril here, the opening to the nose, that very first entrance is called the vestibule. The vestibule is located below the inferior turbinate, just inside the nasal cavity. There are sebaceous glands there and numerous sweat glands that are found here in the vestibule. So you got oil glands and you have sweat glands found here inside. That's the vestibule. It's like when you walk into someone's home, just before you actually get into the home, it's called the vestibule in some homes, okay? Before you actually, or it's like a little waiting area. So right here in the first part of your nose, that's the vestibule. In that vestibule, there's another word that also starts with a V, and sometimes they get students kind of messed up because they both start with V, but just know that they're two different things. Vibrissae. Vibrissae are these coarse hairs, these coarse nose hairs that you can see, especially in some men, they sometimes hang out, that act as the initial filters. And I need you to remember that vibrissae are coarse nasal hairs that are the initial filters. I need you to remember that because I'm going to ask about that. All right? They're located inside of the vestibule, and they serve as a filter to screen out particulate matter. They screen out this particulate matter from the air that attempts to enter the respiratory system. Now, have you seen particulate matter before? If you ever saw a sunbeam, and then you can see all this kind of dust and these things just floating around in a sunbeam, then that's particulate matter. Like there's particulate matter in this room right now, in my home. There's particulate matter everywhere, but we usually don't see it until we see the sun shining. Well, when you breathe through your nose, which is one of the reasons you should breathe through your nose, other than the other ones that I mentioned about it being humidifier and warming, this is the filter part of that. I said it filters, it humidifies, and it warms. This filter part, the Fabriziae, which are coarse nasal hairs, come through as the initial filter, and it filters out this particulate matter. So when I breathe in through the nose, it makes sure that this particulate matter that's in the air will get caught in that hair, and if it bothers me too much, I may sneeze or cough or do something to prevent anything from reaching the lungs. So this is, let me just erase these lips here and this nose. We now know how the air comes up through the anterior nares, which is in the front, or we call it the nostril here, anterior nares. The air is going to travel over the inferior, middle, superior turbinator concha, all the way to the back of the throat, known as the pharynx. Somewhere in this general area of the throat, the pharynx is a posterior nares. You have anterior nares here in the beginning of the nose, and then a general area in the back of the throat is the posterior nares, right? The posterior nares allows air to pass from the nasal cavity into the next major segment of the upper respiratory tract. Now that we got the air moving, we need to put it somewhere. So now it's going to go into the pharynx. That is also known as the throat. So here we'll have the pharynx, also known as the throat. And you'll notice that the air will pass, and you have to know this, from the anterior nares, which is here, into the vestibule, which is here, right inside, just inside the nose. And what is in the vestibule? You got, of course, all these little nasal hairs known as Fabriziae. Now, I know they both start with V, but let's not get that mixed up. From the vestibule, the air is going to pass simultaneously over the inferior, middle, and superior nasal conchas or turbinates. They're going to go, the air is going to go over these so quickly till we say it's simultaneous. We do know that it goes in an order. Of course, the air has to go from inferior to middle to superior to get to the pharynx, but this is going to happen simultaneously, okay? Then the air will go to the posterior nares, which is somewhere near the back of the pharynx in this general area. That makes sense to everybody? I'll go over it. This is going to introduce the air to the pharynx. Air is going to come up through the anterior nares, which we know is the nasal cavity or nostril. Pass all the Fabriziae, go through the vestibule. What's hanging out in the vestibule? Fabriziae, these hairs. Air is going to pass over the inferior, middle, and superior turbinates or conchas as it goes to the posterior nares, which is somewhere in the pharynx. And now we have to end that with the air going into the pharynx. All right, in the throat. Great. So now the air enters the respiratory mucosa. There's a highly specialized mucosa waiting. That's a good thing. So let's see what that specialized mucosa actually is. Oh, okay. This specialized mucosa, and this is something for you to remember. Anytime you hear anything about the respiratory system, this epithelium is the one I want you to associate with the respiratory system. It's pseudostratified, ciliated, columnar epithelium. Pseudostratified ciliated columnar epithelium. Now you guys remember from 240 that how this epithelium looks, but let's just look at it. They're tall, but I gotta make them kind of pseudo-stratified because they're not actually stratified, are they? They kind of look like it. And then I've got to put some cilia on it. So they're pseudo-stratified to make them look as though they're actually stagnant, but they're really not. All of them don't really make it to the top. But then you got this little hairs on here that are cilia, microscopic. They're not like Fabriciae. You can see Fabriciae. Those are coarse nasal hairs. They're black usually. You can see those sticking out people's noses. Cilia is different. These are microscopic. You can't see them. And they line a great deal of the respiratory tract. And that's going to be important because the cilia lines the respiratory tract all the way down to the smaller bronchioles. Why is that important? Well, because cilia beats like this, and it beats up and out. So if something gets past this Fabriciae, this initial filter, then it gets lodged in, let me just remind you that there are goblet cells here. Goblet cells are usually associated with cilia or ciliated cells. What are goblet cells? Do you remember what goblet cells are? Do you remember that I had a goblet, like a king's goblet, golden goblet? And remember I kind of mentioned to you that it's just filled with mucus, right? That's a gross goblet. But that's what goblet cells do. They produce mucus. So mucus is produced by these goblet cells that are in association and great relationship with cilia. So you'll remember that, I think, from now on. That's important so that whatever gets stuck in the mucus will get beaten up and out, and the person will cough or sneeze or feel some way to get this particulate matter out of the system before it reaches down to the lungs. So that is the important part about having this pseudostratified ciliated columnar epithelium in association with this mucus from the goblet cells. I also want to mention to you, let me tell you what page we're on. I want to mention to you that we have some, by the way, you can look at the goblet cells and the cilia on page 809. Let's look on over here on page 803, sorry. Let's look on page 804 now at the paranasal sinuses. Paranasal sinuses. Para means around. Nasal, of course, is the nose. So these sinuses are around the nose. Paranasal sinuses are around the nose. And we have 4 pairs of paranasal sinuses. At least that's the way we're going to look at it. So paranasal sinuses, para, around, nasal. Sinuses really are air pockets. You shouldn't have anything in your sinuses except for air. Anything other than air in the sinuses is considered a sinusitis, an infection, right? So we have 4 pairs of these. Para around the nose, there are sinuses. Sinuses are openings, like holes, and they make the head lighter, so the head's not so heavy, okay? So we have 4 pairs of air-containing spaces that open or drain into the nasal cavity. We have the frontal, and I want you to consult your text on this so that you'll know exactly where they are located. The frontal sinuses are here, named for the bones, like the frontal bone, if you remember that from 240 from your previous human anatomy and physiology class. Then you have the maxillary. Would you agree that maxillary would be maximum? Yes. So these are the largest sinuses that we have. And they're located here on each cheek, like in each, where the zygomatic bone or your maxillary bone. Let me keep it at that, where the maxillary bone is. You have the ethmoid. And then we have the sphenoid. All of these sinuses are named after the corresponding skull bones that are in our heads. So I want you to check your text for the location of these sinuses. Please do that. And because I'm going to be asking about these sinuses, and I need you to know where they're located. Remember that maxillary sinus, which is here and here, are the largest sinuses. Ethmoids, I can't really show you. They're kind of going in here deep into where the nose is. And then the sphenoid sinus is just near where the pituitary gland is. So I can't really show you that either because it's inside my brain, inside my head. So the next important part about the respiratory system is the respiratory membrane. Respiratory membrane. This is a concept that I need you to really understand about the respiratory membrane. Copious amounts of mucus and a rich blood supply, especially over the inferior turbinates conches, that's the lower turbinates conches that I showed you, those folds that allow for great surface area. This permits rapid warming and moistening of dry, inspired air. So right initially, as the air is going into the vestibule of the nose, over the inferior turbinate concha, that air is moistened and warmed because it's so much blood there and copious amounts of mucus and with a rich blood supply. Mucus secretions provide the final trap for removal of the remaining particulate matter from the air as it moves through the nasal passages. So if you guys recall, let me put mucus here. This is the final trap. And what do we say was the initial trap? The first trap, the thing that you have to really make sure you don't get particulate matter down into your respiratory system. Do you remember the initial trap? Because I'm going to ask these things. What is the final trap? Mucus. The initial trap, do you remember it being Vibrissae? Yes. The nose, the coarse nasal hairs is the initial trap. Okay? You guys remember that. Hollow sinuses, these sinuses we were just talking about, remember they're supposed to be empty, full of air, that's it, nothing else. You don't want anything else in these sinuses. They lighten the bones of the skull and they provide chambers for resonating, chambers for speech. They serve as resonating chambers for speech. So if those chambers are, if those sinuses are filled with mucus, meaning they're inflamed and you get a sinus, your sound, your phonation is going to sound flattened. So these sinuses help keep the speech resonating, and when they're empty or full of air. Well, we would say they're empty, but they're full of air. Also, the sense of smell is important, and that passes by the middle and superior nasal conchas over the olfactory epithelium and goes up into the brain. So you will have where your olfactory bulb and your olfactory nerves are. And now you can differentiate between noxious smells versus nice, beautiful aromas, right? So those things, the final tract, mucus, the hollow sinuses that lighten your head and allow for your speech to sound more resonating, and then of course the sense of smell over the middle and superior conchas. Let's go on down to the pharynx, also known in layman's terms as what? That's right, the throat. So let's see about the pharynx. Good. Now the pharynx is a tube-like structure. It's not very long, so let's just know what we're talking about here, pharynx. So it's a tube-like structure. It's about, I'll just put that squiggly line. We know that to mean about or approximately 5 inches, right? About 5 inches. From the base of the skull to the esophagus. And it lies just anterior, so it's in front of the cervical vertebrae. It's just anterior of, remember where your cervical vertebrae are? I think that's C1 through C7. I hope it's C7. Right here, right in the neck. So it's the pharynx or the throat is just in front of that, anterior to it. So it'll be in front. It has 3 anatomical divisions, and you're going to have to check your text for these. I want you to know where they are. So let me look in the text and find out what pages that would be. 804. 804 is where we're discussing the pharynx. But I want you to know these 3 anatomical locations. You have the nasal pharynx. You have the oral pharynx. And then you have the laryngopharynx. Right? And what did we say pharynx was? Yes. It's also known as the throat. So you can see nasopharynx would be nose, throat. Oral pharynx would be mouth, throat. Laryngopharynx would be larynx, throat. Those are the 3 anatomical locations of the pharynx. And I'm going to need you to know where those are. Nose, throat, oral, throat, laryngo, throat. Okay? Nasal pharynx, oral pharynx, laryngopharynx. Good. And remember to consult your text on those. So the pharyngeal tonsils are located in the nasopharynx, the nose throat, on its posterior wall opposite the posterior nares. Okay, that's the pharyngeal tonsils. Adenoids. When the pharyngeal tonsils are enlarged, they may fill the space behind the posterior nares, and it make it difficult or impossible for air to travel, right? So the pharyngeal tonsils are in the nasal pharynx opposite the posterior nares. When they get infected, they're known as adenoids, okay? Let's just put it this way. When the pharyngeal tonsils get enlarged, they're known as adenoids. Let's leave it at that. And they may get so enlarged that they fill the space where the posterior nares are and make it impossible for air to travel, okay? So this is normal, having pharyngeal tonsils. When they get too big or enlarged, usually they're infected, we call them adenoids. We don't call them adenoids when they're normal, like saying pharyngeal tonsils. So that is a difference there. The other tonsil that we are concerned with is palatine. Palatine tonsils. Palatine tonsils and the lingual tonsils. Lingual, you know, it means tongue. So these are little tonsils, little lymphoid tissue, you could say, that are underneath the tongue. They're found in the oral pharynx. So this palatine tonsil is this one, you know, you have that uvula, that little thing that hangs down in the back of the throat. And then you have your palatine tonsils on either side, like that. When we have a tonsillectomy, for example, when you remove the tonsils, they're usually the removal of these palatine tonsils. If swelling impairs breathing, or say antibiotic treatment or antibiotic therapy proves to be inadequate. Now, when I was a child, I wanted my tonsils removed because a lot of kids in the neighborhood had the tonsils taken out, and they'd come back and tell me how much ice cream they got to eat. So that just sounded like fun. So I didn't even know what a tonsil was, but I was like, yeah, I want mine out. I begged my mom to get my tonsils out so I could have all this ice cream. That wasn't wise, so I didn't get them taken out. But if nowadays, if a child, we don't just routinely remove a child's tonsils. In the case of like really loud, harsh snoring, perhaps we'll take the tonsils out. If they get enlarged or big and we see that they have a possibility of obstructing the airway, may remove the tonsils. And if antibiotics are not, the child is getting infected with like maybe annually or twice a year with this tonsils are getting infected, and then they're not responding adequately to antibiotic therapy, then of course we have those reasons for removing the tonsils, but not just routinely like they did when I was growing up. All right, so those are the tonsils. Let me write the other one, lingual, so you'll remember that one is in association with the tongue, and it has to do with being in the mouth. So this is nasal pharynx, these two are oral pharynx. That's where they are, okay? Functions of the pharynx, functions of the throat. I always need you to know about function. I need you to know, why do we have something? What is it doing? So function is always going to be important. So as you study for these tests in my class, I always need you to concentrate on function. You need to know why you're doing this. What is this organ? What is this system doing? What's its function? Well, with the throat, and that's layman's terms, but for us, we'll call it the pharynx. Both air and food must pass through the pharynx. Air and food must pass through the pharynx, so it must go through the throat. Therefore, the little about 5 inches of throat, pharynx, is both the respiratory and digestive tracts are involved with that, right? If air and food have to go through the pharynx, then respiratory and digestive tracts are both involved. The pharynx affects phonation. We talked about that. That's speech production. And vowel sounds. Vowels, remember A-E-I-O-U, and sometimes Y. They come from the pharynx changing its shape. So that's why we're able to have this kind of speech, that we have this type of phonation or sounds that come from us, right? So that is all about the throat. Let's go down next to the larynx. The larynx. Now the larynx is on page 805. Now the larynx, so when you talk about a pharynx, and you say, oh, I have a pharyngitis, please note that's just an inflamed throat, a sore throat. Now we're going to the larynx. The larynx is your voice box. That is a layman's term. Voice box is a layman's term. and it lies between the root of the tongue and the upper end of the trachea, just below and in front of the lowest part of the pharynx. So the larynx, when you have been to a MSU, Michigan State, versus a U of M game, and you're rooting and screaming and really pushing, go green, go white, go green, go white. You may come home that weekend and have a little bit of a laryngitis, where your voice box has been a little inflamed because you were yelling so much for the Spartans. But anyway, the structure of the larynx is a triangular shaped larynx that consists largely of cartilages, right, that are attached to one another and to surrounding structures by muscles and by fibrous or elastic tissue components. Okay, so it's kind of a triangular square structure that has elastic components and muscular components to it. Elastic tissue, fibrous tissue, etc. It's lined by a ciliated mucous membrane. Now remember, the respiratory epithelium was what? Pseudostratified ciliated columnar epithelium. Okay. Now there are we have two pairs of folds in the larynx. The upper pair is called the vestibular or false fold, where there's no vocalization in the upper pair. In other words, no sound is coming from that, no vocalization. And then the lower pair of these two folds are the true vocal cords, and you do have vocalization. Sound is emitted from these lower pairs of vocal cords. The space between the vocal cords, so let's draw these vocal cords. We could draw them kind of like this. If I can show them to you. But they're in your text, so I'm relying on you to use your text to look at the pictures and as you go through the video. So let's look at the true vocal cords, where they look like this. And this space between them, that space between them is called the rima glottis, or glottis. Now this space in between is where, say this is an intubation tube, this is where when these vocal cords are open, I slide that tube in to make sure the person has a patent or an open airway. That would be an intubation when you put a tube down the throat so the person can remain breathing. Now I told you that mainly the larynx is made up of cartilages. There are going to be 9 cartilages that hold our voice box together so that we can have a say or a voice in the world. That's what the larynx is involved with, making sure, and especially for women, that they have a voice in the world. So the cartilages of the larynx, there are 9 cartilages that form the framework of the larynx. 9 cartilages that form the framework of the larynx. So we got 9. 9 cartilages, okay? You have the thyroid cartilage, the epiglottis, and the cricoid. These are the 3 largest single structures. Okay? And I want, when you say thyroid, I want you to put the word cartilage on it. Otherwise, I'm going to think that you're talking about the gland. Because remember, you have the thyroid gland and you have thyroid cartilage. So whenever we're talking about the larynx, you must put the word cartilage with it, thyroid cartilage. Thyroid cartilage, epiglottis, and cricoid cartilage are the 3 single structures. Then we have these, the arytenoid, the corniculate, and the cuneiform. These are 3 pairs of smaller accessory structures. 3 pairs of smaller accessory put 2 S's in there, cartilages. So these are paired. Pairs means 2, correct? So you have 2 arytenoid, 2 corniculate, and 2 cuneiform. 2, 4, 6. That makes 6 cartilages there. 6, and we have 3 here. 6, 7, 8, 9. That makes the 9 cartilages. These are paired. They're smaller accessory cartilages, and they're paired. The interesting thing about these cartilages is, let's see, what the thyroid cartilage, that's one that I definitely want you to take note with, is that the thyroid cartilage has a layman's term that we call it the Adam's apple, right? Adam's apple. Usually can see the Adam's apple pretty clearly in men, and some women, if they're thin enough, and really sometimes you don't have to be a thin woman, but you can see a protrusion of the thyroid cartilage there, but oftentimes in men. Women happen to have a little more of a fat pad over there, so it's softer and it's not as prominent. We need to tell that to Eddie Murphy, but anyway, you'll catch that joke later. So Adam's apple is the largest cartilage of the larynx, usually larger in men than women, and the men have less fat laying over it, right? The epiglottis is very important. So you put an asterisk there because it helps prevent food or liquids from entering the trachea, right? You want that little flap to go over the trachea so that no food or drink goes down into the trachea, which will eventually go into the lungs. We call that an aspiration. You often see this in nursing homes. I don't know why people do this. They kind of just push the tray of food over to the person is leaning over in the chair. They take the straw, they suck, and then there it goes, right into the lung. You know, you got to really help people in nursing homes. You got to help people. You just have to help people. And then the arytenoid cartilage, this one, that is a smaller accessory cartilage that's paired, that has 2 of them. These are important because they're points of attachment for the vocal cords. So the thyroid cartilage, please remember to put cartilage with thyroid. Otherwise, I'm going to think you're talking about a gland. The thyroid cartilage is the largest of all the 9 cartilages. The layman's term for it is Adam's apple. The epiglottis is important because, of course, it prevents food or drink from going down into your lungs. You don't want to aspirate. And then the arytenoid cartilage is a point of attachment for the vocal cords. So that will actually conclude the upper respiratory system. And I think what we'll do is give you a little breather, and then we'll get right into the lower respiratory system.